Keratoconus is a debilitating disease that affects your vision, often your distance vision first. And you may not notice it early on in the disease. Your optician's possibly more likely to pick it up on follow-up assessment. So it's important that you go and see your optician on an annual basis for an eye check. And often they will notice increasing astigmatism on your prescription. That will be the first thing that's noticed. Sometimes patients come to us when keratoconus has progressed significantly, that vision has then just gone down, and they notice that even if they put glasses on, the vision doesn't improve significantly. And for those patients, we often then need to use contact lenses, and as well as periods of time where they're using glasses. But they will always notice that improvement in their vision with glasses is never as good as with contact lenses. Beyond that, as things worsen in keratoconus, nowadays we have a treatment called cross-linking, which can prevent the progression of keratoconus. So essentially what happens is, in keratoconus, the front of the eye goes from a hemisphere to something that's more conical, hence the term keratoconus. And in the condition, they then get multiple focusing of light at the back of the eye, and that's what causes the blur and the sort of the astigmatism that they get. What cross-linking does is it prevents that conical progression of their disease, and it prevents them ultimately, in severe cases of keratoconus where you need to do a corneal transplant, it prevents them requiring a corneal transplant. In severer cases of keratoconus where there is significant progression, or they get subsequent scarring on the surface of their eyes, they then require forms of corneal transplantation, either partial thickness, what we call a deep anterior lamellar keratoplasty, or a full thickness transplant, a penetrating keratoplasty. So cross-linking is a treatment where we essentially prevent the cornea from becoming conical, and it binds the collagen fibers in the cornea so that it strengthens them, and the cornea then doesn't do this conical progression. The treatment involves us removing the surface layer of the eye, so small scratches made on the surface of the eye with a gentle sponge or an instrument. This is followed by riboflavin drops, so it's a vitamin, and these drops are put on for at least a period of 10 minutes. So the eye is soaked in that, and once that's soaked into the cornea, we then apply ultraviolet light, either as a continuous treatment or more often now as a pulse treatment, where we have 1 second on, 1 second off. And the action of the riboflavin and the ultraviolet light on the collagen fibers is to bind them together. Now the treatment itself is done under local anaesthetic, so you come in for the day, have it done, and it doesn't take usually longer than an hour. The treatment itself is relatively pain-free, but the procedure itself in the first recovery over the first 24 hours is quite uncomfortable. So we then give you drops to relieve the discomfort that you might experience or the pain that you experience. We usually follow you up within the first week. Sometimes we apply a bandage contact lens as a protection afterwards. You will then see us in a week's time where we will remove the contact lens. At about a month's time, the surface will have healed and the inflammation will have settled, so that you can then either put on contact lenses or we can get you a contact lens assessment. So that means that the eye goes into a mode of rehabilitation. You go back to normal visual potential. But what cross-linking does mean is that it prevents your keratoconus progressing to the extent that you need a corneal transplant. So anything obviously that prevents you from requiring a corneal transplant, which has a massive impact on your life, it's a treatment worth having. And this is a treatment that we didn't have in the past, and we now have this available.